Welcome to the LGBTQ2S+ Basics, Creating Safer and More Welcoming Care. My name is Heather Cobb. I use the pronouns she, her and hers, and I work with the Sexual and Reproductive Health Program in Calgary as a sexual health promotion facilitator. My colleague Tammy Troutwood and I are pleased to offer you this session as an introduction to the SOGI Safer Places Toolkit. The purpose of this presentation is to enhance your awareness, confidence, knowledge and skills in creating safer and more welcoming care for LGBTQ2S+ clients and families. If you are taking part in a group session to review this presentation, these group guidelines can encourage an environment in which everyone feels that they can participate and ask questions. We all bring different backgrounds, perspectives and experiences to the session, so we agree to respect all the ways that we are different and that we have different beliefs and values. The right to join in or pass each other by listening, the privacy of others, and that any question is okay. You may have attended other training highlighting diversity, the multiple ways we are different. We encourage you to consider the many ways in which all types of diversity intersect. A term that you may have heard of is intersectionality. Using this approach helps us understand how everyone has overlapping identities, and diversity meaning we all experience the world differently. For this session, we're going to use some key approaches to guide our work. We are discussing diversity, which is the range of human differences. It's what makes us all unique. The goal is to consider inclusion, which means valuing human differences and supporting each other to feel safe, welcoming, and have a sense of belonging. And in all, we want to encourage equity, the fair and respectful way we treat all people, while at the same time striving to eliminate barriers that prevent the full participation of some groups. Although we're primarily focusing on patients and clients, and we're going to use this term interchangeably, it's important to consider that some people we work with will identify as part of sexual and gender diverse communities. This information can help us be more aware, inclusive and respectful to everyone. When we create safer and more welcoming healthcare, it increases the quality of care and experiences we offer to all of us. The objective of the next few slides is to provide terms and phrases when talking to and about sexual and gender diverse people. When we understand terms a person's using, we're able to provide good care by acquiring knowledge and showing respect through our communication. We use the acronym LGBTQ2S+, the acronym for lesbian, gay, bisexual, transgender, queer questioning. Sometimes you will see the star or the plus used to represent the many diverse sexual orientations and identities and are part of multiple communities, and we also use Two-Spirit. You'll also see gender and sexual minorities. Not everyone likes every term. A term that we most often use in our toolkit is that of sexual orientation, gender identity and gender expression. We're not going to define every term in this presentation, and so now it's a good time to talk about the toolkit, which can be found on the Alberta Health Services LGBTQ2S+ website. I'll provide details at the end of this presentation. Just remember, language and terms are evolving, fluid, personal, and individual to the user. After all, people are too complicated to have simple labels. What we do know is that terms can be useful and empowering by describing experiences and identities. However, we must take care, as the way people self-identify and how they use terms to describe themselves may have a different meaning than our understanding of the term. It's always best to check for understanding. It can be helpful to break down the terms we're using when talking about sexual orientation, gender identity and expression. We all share the 4 basic traits used in the Everybody tool that you can see in this slide. You may have seen versions similar to this diagram. Sex. This is the term we're going to describe first of all. Sex refers to categories, male, female, to which people are typically assigned at birth based on physical characteristics. Everyone is assigned a binary sex of male or female at birth. And in Alberta, we now have a third gender marker, X, which can only be changed after birth. Gender is a person's internal sense and experience of identity as female, male, both or neither, regardless of sex assigned at birth. Our gender is personal to us, no matter what our sex assigned at birth. Generally, this aligns with cultural expectations of what it is to be masculine and feminine. And this is reflected all around us, in the media, in our families, roles that people play, and in jobs. Gender identity is a person's internal, deeply held sense of their gender. It's not visible to others. So terms that may be new to you on this slide include the term cisgender. I identify as a cisgender woman. I was assigned female at birth and identify and express my gender as female and feminine. Gender can't be determined by looking at someone. When we do this, we are using stereotypes and bias to identify someone based upon how they look. A trans identity, like all other gender identities, is internal. Some people may not identify with a gender and may refer to themselves as gender non-conforming or gender non-binary. We express or perform our gender in many ways, such as through our clothes, hair, makeup, and tone of voice, and this we refer to as gender expression. So the two terms in this slide to learn are cisgender, where gender identity matches cultural expectations of sex assigned at birth, and transgender, where gender identity and/or expression differs from what is typically associated with the sex assigned at birth. But remember, not everybody may identify with a gender. Another part of the SOGI acronym is sexual orientation, a person's emotional and/or sexual attraction to others, which can be fluid and change over time. It may or may not reflect sexual behaviors. Ultimately, the heart wants what the heart wants, and conveniently on our traits diagram here, our everybody tool, you can see that sexual orientation has the icon of a heart. Orientation can be complex, and people try to categorize orientation, but there are so many sexual orientation expressions. It's important to know that sexual orientation is not a lifestyle or a choice. It's part of who we are and our experiences. So these are some of the terms that you might hear, some of the terms that we have mentioned in this presentation already. It is not an exhaustive list. It is changing and evolving. We've provided more common terms, and this can give you an idea of how terms fall under the everybody traits. So on the left, we're talking again about who do we love, are we attracted to, sexual orientation. And some of you may be thinking, I've not heard of pansexual or polysexual or asexual. This would be a good time again to go back to that toolkit. And then on the other side, we have gender identity, where we have some of the ways that people express themselves, remembering, as we said, that some people will identify as non-conforming, non-binary, genderqueer or gender fluid. And with sex, we refer to sex assigned at birth, and sometimes you will see that defined as sex assigned at birth, assigned sex or natal sex. And also we have intersex on this umbrella. Intersex is an umbrella term used to describe people who have chromosomes, hormone profiles, or genitals that do not typically fit with the binary and social constructs of male and female. And we actually can determine and estimate that between 0.05 and 1.7% of people are born with intersex traits. Remember, check back with the toolkit if there is a term that is new to you. And it is important that if a person raises a new term with you, to clarify the understanding of that term by asking them, what does that mean to you? Two-spirit is a cultural term used by some Indigenous people to mean a person who has both a male and female spirit, which may include concepts of spirituality, sexual orientation, and gender identity. Like all identities, Two-Spirit is a term that is self-identified. You cannot assume that as an Indigenous person, they will use the Two-Spirit term to identify themselves. Some people identify as one orientation or gender, but for others it's more fluid, it's less defined. And so we encourage you to consider orientation and gender more like a spectrum. It's more accurate than dividing people into distinct categories. While we use terms and acronyms to increase understanding, we need to remain open to look beyond categories and beyond the binary or the opposing ends, masculine versus feminine, gay versus straight. When we sometimes refer to those binaries and we put people into categories, we're often using something called our unconscious bias. When we're unconscious, it's a state of not being aware of our thoughts and feelings. We develop stereotypes, we filter our experiences through the media particularly without really realizing it. We all have them. It's a mental shortcut where we put people into groups. Biases are formed based on our own experiences. It's when we have a preference for something. It's very subjective. And again, it's based on the media, cultural stereotypes, but also institutional and organizational influences. Sometimes this leads to inaccurate judgment based on limited facts or experiences. And biases can be held by individuals, but they can also be held by groups and institutions. So for example, there can be systemic bias within teams, within professions, and within institutions and organizations. I'd like to give you some examples of bias to help understand why the concept of unconscious bias can help us provide safer and more welcoming care. The first one is heteronormativity. This is the assumption that all people are heterosexual and that this is the norm. So for example, all married people are husband and wife. Sometimes we use unconscious bias and it means that we treat people differently and often negatively. With heteronormativity, I want us to consider that in Canada, marriage or having a long-term partner may be considered a life stage, a life event, or a rite of passage. Many people who don't have the traditional male-female partnerships are treated differently and may not feel that their relationships are celebrated in the same way. The media, certain laws and policies, books, for example, primarily reflect heterosexual relationships and families. And this heteronormativity can lead to some people feeling that their relationships are less than, that they are ignored. While gender norms fit into some people's experience with gender, they don't fit with everyone. Gender norms can limit us from all being fully ourselves. And gender binary is the classification of sex and gender into two distinct and disconnected states, male, female, masculine, feminine. And so it's this example that we assume all people identify as either a man or a woman or a boy or a girl. We see this with jobs and gender roles where people may be excluded, often informally, from a certain occupation or a career goal. For example, nursing may be seen as a career for females and firefighters for males. Societal stereotypes start early. Think about how we dress newborns, the pink and the blue. When someone doesn't fit clearly with the gender binary, our society develops ways of dealing with these stereotypes, and we may call someone a tomboy, or we may refer to a male as metrosexual. Cisnormativity is the assumption that all people are cisgender, and that this is the norm, that only women wear dresses, for example. Cisnormativity is closely linked to the idea of stereotypes, that assumption about characteristics of different groups of people. These stereotypes are rigid beliefs about how people should behave based on their gender identity. For example, boys like sports, girls like to cook, boys don't cry. They vary culture to culture, but they can be very limiting. Now that we know we have unconscious bias, they are those mental shortcuts that we all use, the question is, how can we identify those biases if we don't know that we have them? So some of the skills we can use is we can reflect on what we hear and who we see and avoid making assumptions about them. Be an active listener, learn about people, be intentional when you speak with and about others, and get to know people who are different from you. Ask clients about their needs, be open to their responses, even if they tell you something you have not heard before. Be accountable, take steps to address bias when you recognize it. Today, some of you maybe are having your bias challenged, and it's okay to feel uncomfortable, but it's important to work through it. It's important to acknowledge our bias because everyone is protected from discrimination from Alberta Human Rights Act and from federal acts as well. Folks are protected from discrimination based around gender, sexual orientation, gender identity, and expression. And this legislation exists to protect everyone from discrimination and ultimately from harm. Harm can be caused by stigma. Stigma refers to an awareness of negative societal attitudes, fear of discrimination, and feelings of shame. Negative attitudes are often based on stereotypes about individuals or behavior, and stigma is being used to label certain groups as less worthy of respect than others. The discrimination that someone experiences means that they may be less likely to engage with and access care and social agencies, and this in turn can lead to negative outcomes, whether they be health outcomes, social, or education. This in turn can mean that people don't get the care that they need. I want you to consider, if you eat at a restaurant, you don't enjoy it, you have the option to not return. Healthcare is different. Consider someone living in rural Alberta looking for support and care. If they have a negative experience at their healthcare clinic, they may not have the option of going somewhere else. Services are limited. This may mean that they ignore a health problem that gets worse. They may become isolated. So let's look at some of the reasons why providing inclusive, safer care matters. Health research has identified an increased risk for people who identify as LGBTQ2S+. We know that many people may not have told their healthcare provider about their gender identity or expression or their sexual orientation. Being healthy is about being a whole person. For many, it isn't easy to talk about sexuality, sexual orientation, or gender identity, but there are many benefits to talking with healthcare providers. Sharing information helps make sure people get the right care, but some people are concerned about confidentiality or have heard stories of others who have received poor care. When healthcare providers are aware of the increased risks for people who identify as LGBTQ2S+, they can make sure that they are carrying out screening and asking the right questions. But with confidentiality, it's important that healthcare providers acknowledge that sometimes their client may not have told their family, their friends. People may feel uncomfortable to present with health problems, and in particular this is related to healthcare screening. We have a saying, which is, if you have a body part, it needs to be tested. And so for especially transgender folks, we need to encourage people to come to our care for example, Pap tests. If someone has a cervix, they need a Pap test to check for abnormal cells and cancer. If someone has testicles, they need to learn about testicular cancer and self-exams. A prostate, need to know more about prostate health and screening. Healthcare providers must work to include everyone in their health promotion so that no one feels that they are left out for things such as screening. So now we know a little about terms and definitions. I guess this is the so what, the reasons why SOGI is important to understand. In these next few slides, we're going to discuss what we can do to create safer and more welcoming care, and we're going to begin with communication. What is inclusive language, you might ask? Well, we need to use inclusive language so that everyone is included. Inclusive language means not using words or expressions that may exclude some people and that reinforce stereotypes. For example, we say chairperson instead of a chairman. Inclusive language also means that we don't make assumptions. For example, when we ask about a child's parent, we don't assume who the parents are. When we meet someone, we can ask the name they go by and their pronouns instead of assuming their gender identity. Our names are important to all of us, regardless of our gender. Our name is part of our identity, our story, our history. When we use the name someone goes by, we're telling them we respect you and we care about you. You are welcome here. This is important as some people will use a different name to what is on the healthcare card. Here are some examples of how we can use inclusive language to avoid reinforcing stereotypes and making assumptions about people based on their relationships or their gender roles. So for example, husband or wife instead of spouse. When we meet those parents, let's not assume that it's necessarily mother or father. You may have noticed that I started the session by introducing my name and my pronouns, and my goal is to help anyone who wants to tell me about their pronouns feel safe. Pronouns are words we use to talk about people when we don't use their name. So for example, we might say, "Have you seen Heather?" The reply, "She's over there." Someone is using my pronoun. And my pronouns, as I said, are she, her, and hers. Those are some of the typical pronouns that you will be familiar with. The she, the he, the her, him, hers, and his. Ask about pronouns and use them when talking to a person, and equally as important when talking about them. Don't assume you know the person based on their gender expression, what someone looks like or sounds like. Ask, what pronouns do you use? So you can see they, them, and theirs, which has become a much more common pronoun for folks who do not want to identify with the typical she and he. And some new pronouns are the sie and the per, and you can see some examples of how those might be used when wanting coffee. When pronouns are not important to you, you probably don't take much notice. But when you want to tell the word about your identity, pronouns are a way to do this. Pronouns are not preferred. They are the pronoun or name that someone uses. So what about talking with clients? So consider introducing yourself in a welcoming and inclusive way. So I might say, "Hi, my name's Heather, I'm your sexual health educator, and my pronoun are she and hers." We can all recall a healthcare visit where we have either felt welcomed and involved, or when we didn't have a good experience. As soon as a person enters the building, their care begins. So how do security staff engage when someone asks for directions? How do they feel when they check in with admitting? Are their details such as the name and pronouns they use versus what's on their healthcare ID communicated and used by all staff they interact with? Don't assume gender based on physical appearance, because remember, those are based on what we've learned from our experiences with the media, with books, for example, and they often are based on stereotypes. There is importance of self-identification. What you see and your unconscious bias may interpret and not reflect the reality for your patient. If someone tells you they are a Joanna, but your eyes see and your ears hear a John, how do you react? When a person uses a term that is new to you, ask them, "Can you tell me more about what that means?" so you have the same understanding. Remember, this is about getting to know someone, dropping that unconscious bias, and being open to learning new information. Listen and reflect back the language. The patient might not use those correct medical terms when talking about their body parts. Ask. Use that language when talking to and about the patient. Don't ask a question if you don't need to know the answer or it's not relevant for their care. And as mentioned previously, always protect confidentiality. With the patient's consent, document and communicate this to others. Back to the names. We all know a William, whom we call Bill, because they prefer that name. We know a Betty, whose legal name is Elizabeth. Often we don't even know the person's legal name, but out of respect, we should use the name that they go by. When talking with clients, sometimes we get it wrong. So what if you do get it wrong? The first thing to do is to forgive yourself, because this can be a new experience and we don't always get it right. We may inadvertently call someone sir when in fact they identify as female. And while we use traditional greetings and manners because this can be the best way to be respectful, be careful not to misgender someone. The key is to recognize the error, apologize to the person and move on. Do not over apologize. This is not about you. And when we over apologize, we can make the interaction uncomfortable. We may need to practice using scripts to. An ally is a person who advocates for the human rights of people who are LGBTQ2S+. So for this slide, I want you to ask, how can I be an ally? Don't assume sexual orientation or gender identity, and advocate for respect and inclusion for everyone. We've discussed ways in which people can feel discrimination, which leads to stigma and less access to care. Now that you are aware, you can check yourself, and when you hear others, you have the words to use to challenge if it feels safe. Alberta Health Services Diversity and Inclusion have developed a series of posters and podcasts to encourage people to change the conversation. So for example, when someone uses a joke or a comment that's so gay, someone can reply, when you say that, I hear you saying it's a bad thing. Challenging can be tough. You may need support from your teams or other colleagues to do this, but now you may have some language to be inclusive as you continually learn. We sometimes forget that our physical environment also communicates messages. Environments and the policies and procedures that create them can feel unsafe and alienating, or safer and welcoming. I'd like to refer you to the checklist in the SOGI toolkit. Consider using this list going from the outside of your service and into every space used by client, staff or visitors. Who can access this space? Who can feel comfortable and welcomed in this space? Who might not see themselves there? This can be a starting point for conversations with your colleagues to identify ways to show inclusion. The rainbow flag has become a common symbol of acknowledgement of SOGI and is used to indicate a safer, more welcoming space and service as a signal of others to inclusion. It's important that if staff and spaces display the rainbow, they can demonstrate inclusive care and are moving towards safer and inclusive spaces. A note about forms. After learning about the terms for SOGI, you may start questioning the program forms. Are people able to tell you about their name, pronoun, sex and gender? Finally, do you have information for clients about how they can voice a concern about care? Healthcare can only get better when people feel they can be open and honest to share concerns and problems. So as we wrap up, consider the call to action. Next steps include reviewing the SOGI toolkit, and you can see the website here. Complete the pre and post assessments that are included in the toolkit, and you can do this either alone or with your teams. Reflect on your learning by asking yourself, what can you do to create safer and more welcoming care for your patients and families? Information and resources can be found on the ahs.ca page as listed here, along with some focus from diversity and inclusion. And finally, for AHS, if patients have concerns and feedback, here is where you can send them. Finally, what does safer and inclusive care look like? As part of our work with the patient advisory, we asked for responses to the question, and the answers were then placed into this word cloud and demonstrate some of the goals of care that we are working towards. We're all patients of AHS. It's how we all want to be treated. Thank you.